Muscle Monday. Today we're going to be talking about anterior muscles of the forearm, specifically talking about more of the fingers and the wrist and ignoring the radial ulnar joint muscles like supinator and pronator teres. I'm going to go into super detailed about the specific muscles because a lot of the finger muscles are just the same thing except where they insert on the bones. So one's going to insert up here in the middle, down here, versus one's going to insert right there, then all the way up there. Kind of just depends on what bone we're talking about specifically to each finger. We're just going to categorize them as finger muscles overall, specifically performing only finger flexion. So what do we know about it? Well, something to keep in mind is if it's a finger flexor, it's also going to assist with the wrist flexion because of the way it starts and ends. It crosses over at the wrist, meaning whenever this muscle tenses, it's going to assist with going into wrist flexion, but not very much. It's focusing more at the fingers. Versus the wrist flexors, it's not going to assist with the fingers because it only crosses the wrist and not the digits. Nice thing with these muscles is that the wrist flexors and finger flexors all start on the same place, the medial epicondyle of the humerus. So in theory, technically they do assist with elbow flexion, but in reality, no. For the wrist flexors, we're going to specifically talk about three separate muscles: flexor carpi ulnaris, flexor carpi radialis, and palmaris longus. We're not going to talk about when they insert because all you need to know really is that they insert somewhere in the hand. Whether it's the hamate or a cuboid or whatever, it doesn't matter. All you need to know is that they cross the wrist. And as you can tell by the name, flexor carpi radialis is going to help go into a flex position, but also radialis is going to go into a radial deviation versus flexor carpi ulnaris going to go into flexor, and then it's also going to go into an ulnated position. Basically, if you don't know what the deviations are, is radial deviations, you're going to be bringing your thumb towards in, versus ulnar deviations, your pinky towards out. If it's the other way around, ulnar deviation has more movement, whereas radial deviation has very little. It's going into a side position. Well, yes, the finger flexors are primarily used for fingers. They do assist with the wrist flexion, so I'm just going to briefly go over some of them. Flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus, which just means thumb, and indicus is just your pointer finger. The theme with all these muscles is that they help go into a fist and then curled up. So how do we abuse that knowledge? If you want maximum growth of the anterior muscles of the forearm, excluding, like I said, the muscles from earlier, what you're going to be doing is a curled finger grip and then going into a flexion. But what this is going to be also causing a problem for is active and passive insufficiency. As you can see, when my hand's like this versus when my fingers are straight, it goes down slightly lower. I want you to try it. Put your hand down like this. Your fingers are going to automatically try to straighten, try to make a fist. You really can't. And if you can, you feel a big stretch on the top of your palm. And that's because of active and passive insufficiency. These muscles are contracting too much versus the muscles on the back are stretching too much. So because of that, if you want to be more optimal when it comes to maximizing those muscles, you're only going to focus on some